Good afternoon, everyone. My name is Justin, and I'm going to be teaching you about a new medication today. I have my wife here with me since we are, of course, in the quarantine, and we're a little short on supplies. So as far as epinephrine auto-injectors go, which we're going to be doing our patient teaching, this is what they typically look like. But today, we're going to use this Paw Patrol pencil, and it should be great. So first, I'm going to greet my patient. Hey, Sarah, how's it going today?
Hi.
My name's Justin. I'm a student nurse, and I'm going to teach you about a new medication that we prescribed you since you had a bee sting and you had a little bit trouble breathing, and you spent the night in hospital for observation. And now we're going to talk about a medication called epinephrine, and it comes in an auto injector, and it kind of looks like a pen. Here's a picture of it here, and as you can see, on one end there is a blue cap. That's the safety end. And on the other end, there's an orange or red. That's the business end, and that's the end that the needle's going to come out.
Okay.
So I know it sounds a little scary now, but we're going to walk you through it. So last time, I understand that you had some shortness of breath and some rashes on your body after you got stung by a bee. Is that correct?
Yes.
Okay. So kind of the same indications. You're going to get this EpiPen from the pharmacy. And it'll come probably with 2 of these EpiPens or auto-injectors. They might be generic or they might be the name brand EpiPen. They're all the same. They kind of work the same. And basically the indications are when you would use these is if you got stung by a bee and you are having that shortness of breath or rash or your face or tongue kind of starts to swell up. And you get a little nervous about it, this is a medication that's going to give you some time to seek further treatment. So what you'll do is you'll take the safety off of this end. You see it there? And that's the safety end. So taking the safety off is going to activate this pen. So when you're doing that, you're going to want to hold it like this. Like this. You're never going to want to put your fingers over the top of either end. So hold it like this, take the cap off, so that's when it's activated, and your target area is going to be the outside portion of your thigh, right in the middle. And with these, you don't have to worry about if you're wearing clothes. If you're wearing multiple layers, then I would take a layer or 2 off, but if you're just wearing street clothes, there's no problem. What you're going to do is you're going to press that into your thigh with a little bit of force until you feel a click, and then you're going to hold it there for 10 seconds. Afterwards, take it out, and you're going to want to massage the site for 10 seconds just with your hand. Now, if you're having a hard time breathing, it's not a bad idea to have somebody do this for you. And of course, there are directions, if you forget, right on the side of the auto-injector. After you do administer this medication, there are going to be some things that might happen. You might feel a little restless. You might feel like your heart's beating a little faster than normal. You might feel a little anxious, sweaty and pale, and those are all side effects of this medication. And from this medication, you should have a little bit better, easier time breathing. But don't be fooled. This medication is not a sure cure, so you do need to seek immediate medical attention afterwards. Some things about the pen: they usually come in 2s, and one of them is the trainer. So when you get the box from the pharmacy, you can practice with the trainer, unlike this Paw Patrol pencil. But for now, I'll have you take the safety off of this one and demonstrate, how to use it, So when would you use this?
If I got stung by a bee and I started developing those symptoms of
Perfect.
shortness of
So
breath.
here's your EpiPen.
Okie dokie.
So how do you hold it?
Like this.
Perfect.
Okay.
All right.
And I take it the color end is the stabber?
The red end or the orange end is the business end.
Okay.
And then the other
But this
end.
is in that I have to pull.
Yep, pull that end off.
Okay.
All right, and now you're ready to go.
Okay. Right in there, huh?
Right in the middle portion of your thigh.
Okay.
Yep.
1,
All right.
2, 3, 4, 5, 6, 7, 8, 9, 10.
All right. Very good. And then you're going to massage it for 10 seconds.
1, 2. Can you count with me?
And in those
3,
10 seconds, do
4.
you have any questions about the medication?
No, I don't think so. I think you covered it.
Okay.
Very
Well,
well.
I'm going to give you this this educational guide. If you have any questions or things like that, everything is in this packet.
Okay.
Another few things to consider. You're not going to want to store these in anywhere where the temperature is going to be sensitive. So in your car where it can freeze or get super hot is a bad idea. And it's a good idea to set an alarm on your phone for when these expire. So it might expire next year or the year after. But if you plan on having the same cell phone, you might as well just put it in there.
Okay.
And periodically, you know, if it's in the medicine cabinet or something, just look and make sure that the liquid inside isn't cloudy or discolored. It should be clear to yellow clear. And if you have any issues with your epinephrine auto injectors, feel free to give us a call at the office here.
Okay, sounds good.
All right.
Thank you very much.
Have a great day.
You too. Where are you going?